Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Lynn Sisha. She is the nurse manager and program director of Bergen Newbridge's Child Adolescent Unit and manager of the Psychiatric Forensic Unit. She is an ANCC certified psychiatric and mental health nurse with 7 years' experience serving this population. Her passion is helping our patients achieve their own optimal mental, spiritual, and physical wellness, and enjoys incorporating holistic modalities into her practice. While the majority of the LGBTQIA plus people lead happy, healthy, fulfilling lives, studies have found that this population face up to twice as much abuse or violence, including physical, mental, sexual, or emotional, than their heterosexual counterparts. This prejudice and discrimination add an additional layer of risk on top of the biological, social, environmental, and psychological factors, which can lead to depression, anxiety, and suicide. As allies, how do we support our youth, assuring they're living healthy, supported lives? Welcome, Lynn, and happy Pride Month.
Happy Pride.
So, what does the LGBTQIA stand for? And what are some of the risk factors faced by the LGBTQIA youth that affect their mental health and well being?
Absolutely. So we'll just start from the top. The L is lesbian, and that's a female with a female sexual orientation. Gay is male and male sexual orientation. The B is for bisexual, which is being attracted to both males and females. T is for transgender, and that's identifying with a gender that is not your biological sex. Queer, it actually sometimes goes for two different. Q is for queer, and also questioning. So queer used to be a slur, but it's really been reclaimed by many people in the community. Um, it's hard for me to define because for many different people it means different things, but it's seen as an inclusive term that can really mean anything on the LGBTQIA spectrum. Um, and then questioning is questioning, not sure what your identity or sexuality is. The I is intersex, and that is when someone is born without a defined sex. And A is for asexual, which is a lack of sexual orientation or attraction. And so, definitely one of the issues that the youth face is just not being accepted. We've really made strides, but there's still a lot out there that, is really difficult. They may not be accepted by their families, their schools. There's a lot of bullying. Their peers may not accept them. So it's really important to provide the affirming care because that's not even accessible everywhere. These people, the youth, they're identified as having an increased risk for depression, substance use disorders, suicidal ideation, attempts, homelessness, and other negative health outcomes.
Wow. So, why is it so important for providers to show about how to care for LGBTQIA patients?
So there's actually some really startling statistics out there. 42% of LGB high school students and over 50% of transgender and non-binary youth have seriously considered suicide in the past year. Um, just mind-boggling. 22% of LGB youth have binged alcohol in the last 30 days, and 72% of LGBTQIA plus youth report recent symptoms of generalized anxiety disorder. So think about that. There's such a huge need. They're really struggling. Not like you said, it's not everyone, but the statistics are large compared to the general population. So being able to have that support from providers to really know what these youth need to. It's just everything. They really, most are resilient. And some of the most protective factors are acceptance and social support. So if they can't receive that at home, we need to be able to provide that. And whether they accept it at home or not, even if they do, we still need to be able to provide that support for them.
So true. So, what are some ways providers can support the LGBTQIA youth?
So, in my opinion, one of the biggest things is really being informed, and knowing what the best practices are. It's putting, maybe any thoughts that you have aside and really examining that and saying, we all grow up from different places. We all have internalized biases that we're not even aware of. So we need to examine that and put it aside and know what's best for not just our patients, but humanity. Um, and using these best practices, this affirmative care that shows support for someone in their identity, whatever it may be, it creates that accepting place. So being welcoming and inclusive, being non-judgmental, and also, really in your care, making sure you ask the questions. Some people are so afraid to ask about orientation or identity, but that's what makes it normal. And that's how whatever someone identifies as, how to provide the best care. Because these stigmatizing experiences, they can start at even a really early age. I actually get asked a lot by other providers. I didn't get that. Oh, could you try again? Sorry, Siri wants to join. But a lot of other providers ask me, like, what do you do when the families don't agree, when they aren't supportive? And so that's also why it's so important, because sometimes we may be the first people who show acceptance. And that's the seed that can start everything. All this data, they disproportionately run away and are homeless. Think about it. 4.5% of the general population identify as LGBTQ, and as many as 40% of homeless youth identify as LGBTQ. So we need to be there, say, I see you, I accept you. And with the families, listen and do our best to build relationships. We can't fix everything, but we can be supportive and help them build relationships that are going to be protective.
So I'm just going to spin off on the family thing. How do we support the families? It's difficult. It truly is. It's difficult on many levels, especially if the parents are heterosexual. How does a parent, support more than just saying, I see you? Because this is throughout the teen piece, right?
Yeah.
Teens do struggle. Heterosexual, LGBTQ, they struggle, right? How do you support the LGBTQIA, youth, and give them the tools and confidence, even though mom and dad or, guardians don't have a hard time with it?
So part of it, you always have to, when you're dealing with the guardian, the parent, if they aren't fully accepting or maybe not accepting at all, pushing them is going to push them away. Meet them, listen to their concerns, validate their concerns, but also never give up on being affirmative that this child is okay as they are, and always bring it back to, this is still your child. This is your child. This is, I don't know any parent that just wants to give up on their child. And so say, you have differences of opinions, but this is still your child and they still love you and need you. And really kind of putting that into perspective, I think really helps people. Also, giving them different support groups, which I'll talk about later, where they can maybe meet other people who are struggling and help open their worldview. And for the youth, them also have supports for them is really helpful.
Those are great key points. So, what is the difference between sexual orientation and gender orientation? And
So
why should.
sexual, oh, sorry.
No, no, that's fine. That's fine. I'll continue on the next part of it.
Okay. Sexual orientation is who you are sexually attracted to.
Okay.
Gender identity is what you identify as. So I may have been born with the sex anatomy of a female, but that doesn't mean I identify that way. And just because I identify as female does I can still sorry, let me start start over again. So say I identify whatever my biological sex is. I identify as female. That has no bearing on my sexual orientation. My identity is female. If I like men, then I'm heterosexual. If I like women, I may identify as lesbian or, queer or whatever, but they are separate. And actually, it is a very deep conversation. There's a lot more to it. Darian Aledo, as you know, you're having the In the Know with Ro on the 23rd at 2 p.m. And she's really going to do a deep dive into these issues because they are so important.
Thank you for bringing that in because with it, when you're looking at just the surface, there's a lot more to those other pieces that I'm sure that a lot of allies would like to know more about. So thank you for that. So why should we ask our youth about their sexual orientation and their gender identity?
Yeah, like I said earlier, it's normalizing. If you're afraid, if you tiptoe around the subject, they're going to say, "Oh, why are you uncomfortable? It must be not normal." But if you're comfortable and you are able to just ask like a normal person, that's entirely appropriate. And it's what then you get the knowledge to be able to care for them in the best way. Oh, go ahead.
No, no, that makes sense. That makes sense. And being able to really just making part of it, the conversation normalizes it even more, So
Mhm.
I totally, and start in the conversation because there's an interest there and that gets them a little bit more comfortable. Am I correct? Any teenager.
Absolutely.
Yeah. So, just to bring it into your repertoire of getting to know your teen or your youth, whether they are part of the LGBTQIA, community or not, it's nice to start the conversation, to start that comfortable place. Am I correct?
Absolutely. And think about it. There is bias out there, there's hatred out there. If you don't ever ask about it, to even someone who may be biased, you're showing that implicit bias in yourself. You, by asking, even if they get offended, you just say, "I'm sorry, people have different identities and sexualities. And I just always want to know what yours is or anyone is so I can provide the best care." And that shows you're an ally and that shows you're supportive. And people notice that.
Absolutely. Absolutely. So, what are the preferred pronouns and why are we using them? Important.
So, yep, absolutely. Preferred pronouns. That is the pronoun that aligns with what my gender identity is. There's actually, it's not just she and he anymore. It's really cool. The kids have come up with a lot of different options for people who may be on the, I don't know, gender identity spectrum. But the important piece, and I'll let Darian get into that, but the important piece is using whatever someone prefers, because that means you're acknowledging their identity and you're showing respect and acceptance.
Yeah, and that makes sense. I mean, knowing how to address somebody by their pronouns, I think is super important. So how do you start that conversation? I mean, as professionals, we started using them on our closing, tagline. It's on our LinkedIn. But how do you start that conversation? How do you begin that? My pronouns are. What's the best practice?
You literally just do what you said.
Okay.
"Hi, my name is Lynn. My pronouns are she, her, hers. What name do you go by, and what are your pronouns?
Wow. Okay.
It's
Simple
so
as that,
simple.
right?
Yeah,
And it's really truly, getting comfortable with saying that, I think, is so important, especially when, you are interacting with the younger generations. Am I correct?
absolutely.
Yeah.
And we, as an older generation, we're so anxious about it, but they are so, like, generally so much more accepting. And that just shows that, some adults get it.
Yeah. Yeah. Well, we try to anyway,
We
right?
try.
We
I may not
try.
be up to date on the TikTok, but I'll ask you your
Exactly.
pronouns.
Exactly. I didn't have those tools in my toolbox. I keep saying that to my kids. So, how should a provider ask about sexual orientation and gender identity when doing an assessment?
Yeah, so that's definitely a really good one. I think, again, like the pronouns, people get uncomfortable, but they're really, it's a little bit more important once you start digging deeper, um, especially to go by different age groups, right? Because different age groups have different reasoning, and they might not have the words for certain things.
Hmm.
One of the things, because not everyone's accepting, it's always really good to just, if possible, do an assessment without anyone else around so that they feel more comfortable. And or you could do a paper form without oversight from someone on the outside, and just always, you would normalize it, saying, I'm going to ask you questions that I ask all patients your age because it helps me provide care. And you also explain that this is private information. If you don't want me to share it, I won't share it or put it in your medical records. You need to give me permission for that. And when asking by different age groups, if they're like, 10 to 13, you're not going to say, what is your sexuality? Have you ever had a crush on someone? Was that someone a boy or a girl or some other gender? Once they're a little older, you can say it in, more adult terms. Are you sexually attracted to boys or girls? Both? Neither? Some other gender? Are you questioning? Um, and then for anyone, you can say, do you consider yourself straight, gay, lesbian, something else? Maybe you're queer or pansexual or asexual. Um, and if they say something else, you say, what terms do you use to describe yourself? Because that just, again, it goes back to being patient centered and person centered. Um, and then for gender identity, if they're young, you can explain it, and this you can do really any very, very young. You would just say, some people, some kids, they feel like a girl on the inside, and some feel like a boy on the inside, and some don't feel like any boy or girl or something in between. What do you feel like on the inside? And know that there's no right or wrong answer.
Makes
And
sense.
as they get older, you can modify that to something a little more adult, but
Right.
on the same lines.
Right. Or take a deeper dive in explanation, so.
Yep.
Makes sense. So, what are some of the resources that providers can recommend for the LGBTQIA patients?
So we are very lucky that we live where we do. In Bergen County alone, there actually, in northern New Jersey, there's quite a lot of resources. Um, there's something called the Bergen County LGBTQ plus Alliance. It's a more recent um, organization, but they have workshops, events, and various support groups. They have a weekly youth support group, um, and they're really, really very active in the community. There's GLISTEN, and that stands for Gay, Lesbian, and Straight Education Network. Um, that's an organization, they've actually been around since 1990, and they really champion LGBTQ plus issues in education. They do also have a Northern New Jersey chapter that people could reach out to get supports in their school system. PFLAG stands for Parents, Families, Friends, and Friends of Lesbian and Gays, also a national organization with a Bergen County chapter, and they have online meetings every month. Um, right now, their meetings are transgender focused, but the New York, Northern New Jersey PFLAG is in Glen Ridge, and they support those who identify as lesbian, gay, and bisexual as well as transgender. And this is another really great one. There's some place called the Rainbow Place organization. It's called the Rainbow Cafe. That's in Cresco. So that's a safe, supportive place for LGBT teens, grades 6 through 12. They have chaperoned events, and they have a support group and a social group. So they're actually having a red carpet prom upcoming on the 17th.
Oh,
So
nice.
it's where they can be themselves, and it's chaperoned. So it's safe for all these various ages. And then it shows that there are adults that accept. And a really big one, there's something called the Trevor Project. That's another national organization, and they support LGBTQ youth 24/7 all year round. They have counselors that a youth can call, text, or chat at any time, and it can be in need of any type of support. If anything from loneliness to feelings of suicide, not being accepted by your family or friends. So that's a really great organization that helps our youth.
These are great resources. But I'm going to go back on the ally and the family. How can the families in the and family, friends, allies support the LGBTQIA youth in creating a confident, young person, and give them places where they can be safe and not, explore in areas that may not be the safest thing to do because they're not sure. They're looking for acceptance. How can we support them in that area?
I would say just even from a young age, make it normal conversation. Um, if you're walking down the street and you see any family that maybe not the norm, if they ask a question, you just say, some people have different families. Some men like men and they have a family, or women like women, or in between. Families can look all different, and that's what love is. If you start that from when they're young, that is really going to be the base of open conversation and showing that you're accepting. Also, making sure your home is a safe place. Now, this is helpful for not just LGBT youth, but really any youth.
Right.
Have an open dialogue. Don't be punitive in the sense that if they come to you and say, listen, I made a really big mistake, don't be punitive. There are consequences. I'm not saying don't put the consequences out there and say, well, this is the rule and this is the consequences. But blowing up when they came to you in confidence, it just kills dialogue. Mm-hmm. So being able to always have that open dialogue, if you didn't start young, you can start now. Have a family meeting and say, like, listen, I want to be there for you, and I want to be a support for you in whatever you need. And so I want you to know you can come to me and be present. It's like our last In the Know with Ro. It's support of any child is being present. And then in your own life, be an ally in the sense that you can join groups. You don't have to identify as LGBT in order to be an ally. You can support these groups, not just financially, but also with your time. I mean, even your Facebook posts, people see them. Are they supportive? That alone is really big. It's going to show who you are.
That's great advice. I know that older generations struggle with this, and the more that we talk about it, the more that we bring this forward. I think that we will be raising more confident young people, in any community. I think it's really important. The dialogue is a huge piece, and the safe spot, knowing that you can always go back to family, non-judging, even though they don't agree with the choices you've made, that you're being supported in the choices that you do choose to make. So I do appreciate you taking the time, Lynn, to talk to me. This is a really important topic, especially for, like I said, families that still are struggle with, this conversation. So it just bringing the In the Know Row and having the conversation and being able to give people the tools they need in order to start the conversation is so important.
Yeah, it's, it's being human. It's
Yeah.
loving one another.
Yeah.
Love is love.
Yep, that's so true. That's so true. So thank you so much for joining me today to bring some clarity, for giving us some important tools to put in our toolbox. And as always, for more resources, please visit our webpage at newbridgehealth.org. And if you'd like to support our foundation, the link is there also at newbridgehealth.org /foundation. And I look forward to Darian's talk, and we'll be taking a deeper dive and talking about pronouns in the LGBTQIA population. So thank you again.
Thank you, Ro.
Okay, take care.
You too.